Hi friends, welcome to classes by Lab Doctor. In the previous class we discussed what is anemia. Today let us try to find out what are the causes of anemia. Anemia is when your hemoglobin concentration or your RBC count is less, which results in decreased oxygen carrying capacity of the blood. Okay, क्योंकि it is your hemoglobin only or it is your RBCs which carry this oxygen to your tissues. If they are less, the oxygen carrying capacity itself is less, and once your body doesn't get enough of oxygen, it causes various symptoms. This condition is called as anemia. Okay, anemia is not a disease, it is a manifestation of a disease. It could be because of an decreased iron content in your body, or because of some chronic disease causing anemia, or it could be because of certain leukemia, myelofibrosis, hypoplastic marrow. It could be anything. So when we say anemia, we will have to see, like in a man, we say that if the HB is less than 13 grams per liter, it is anemia. In non-pregnant women, if the HB is less than 12 grams, then we say it is anemia. In a pregnant woman, if her hemoglobin is less than 11 grams, then we say it is anemia. Okay, so whenever you are classifying, or whenever you are coming to a diagnosis of anemia, you will have to take into consideration the gender, the age of the patient also. So now, what are the causes of anemia? One is anemia can occur because there is an increased requirement, like pregnancy. The demand for the body is high. So that time the lady can have anemia. Lactation, she is breastfeeding. That time the demand is more. Menstruating female, she loses blood every month. So the demand will be more, and hence she might land up having anemia. Or children, growing infants, children, they are growing, so they will require more of these nutritions, and hence there are chances that these kids might end up in having anemia. So certain conditions where there is increased requirement, there will be anemia. Or certain condition when there is increased blood loss, like the patient is having GI bleeding, he is having an ulcer, he is losing blood silently, so that losing of blood can cause anemia. Or the lady is having menorrhagia, her duration of the periods are more, or she's having heavy bleeding, patient is having hematuria, patient is having parasitic infection. So all these condition can lead to increased loss of blood. So when the blood is lost, the RBCs, the hemoglobin is gone, and patient will have anemia. Sometimes patients have a poor intake of certain food items, like especially your nutritional anemia. So like they are strict vegetarians, vegans, they're very poor socioeconomic status. Such people develop this anemia. Or they are having enough of food, but then there is abnormality in the absorption, like there is some ulcer, or there is some Crohn's disease, celiac disease, patient has undergone gastrectomy, bariatric surgery, patient is on certain medications like antacids, etc., then patients can have this kind of an anemia. So anemia can be because of various reasons. It could be increased requirement, or there is increased loss of blood, a decreased intake of certain food items, or there is decreased absorption. So when we classify anemia, there are various classifications of anemia, some based on the etiology, like we have nutritional anemia, non-nutritional anemia, like this. We classify sometimes anemia based on the size of the RBC, microcytic, normocytic, macrocytic. Sometimes we classify it based on the reticulocyte count. Sometimes we classify it based on the marrow response, hypoproliferative, hyperproliferative marrow, etc. But remember, whenever we say it is anemia, there is certain cause. Okay, it could be anything, but there is a cause, because anemia by itself is not a disease. It is just a manifestation of a disease process. So here you can see that we classify here anemia as nutritional specific anemia and non-nutritional causes of anemia. So now when we say nutritional causes of anemia, the it could be iron deficiency anemia, which causes microcytosis, or it could be folate deficiency, vitamin B12 deficiency, which we usually see in our patients. Okay, so these are the nutritional specific causes of anemia. So there is decreased intake, or because of their certain food habits, or because of the socio-economical status, they are not taking enough of these nutritions, and they land up having an anemia. Now there are certain other non-nutritional causes, like patient is having blood loss. I have explained, it could be a postpartum bleed, it could be menorrhagia, it could be a GI ulcer, it could be passing of blood in the stools, passing of blood in the urine. Okay, all this can lead to blood loss, and when there is blood loss, that can cause anemia. Okay, so that is blood loss. Now what can happen otherwise, that there can be hemolysis. Now the RBCs itself are getting broken down. So there is like an infection like malaria, they can infect the RBCs, and they can make the RBCs to swell up, and the RBC can break. There can be hemolysis. There can be certain autoimmune condition which the antibodies are produced against their own RBCs, and the RBCs can be ruptured. So again there can be anemia. It can like immune mediated hypersplenism. There is hemoglobin disorders, like you have your thalassemia, sideroblastic anemias, enzymopathies like G6PD deficiencies, etc. All these can cause the RBCs to break, and the patient can have loss of these RBCs. There is loss of hemoglobin, and patient can have anemia. So these are non-nutritional causes. Then there can be deficient erythropoiesis. The erythropoiesis itself, the production of this RBCs itself is hampered. Like if there is certain kind of inflammations, like in certain thalassemias, or the bone marrow failure, the marrow itself is not able to produce this RBCs. Like there is there is a leukemia, there is myelofibrosis, there is metastatic deposit, or there is aplastic anemia. By all this, what happens, marrow is not able to produce enough and more RBCs, hence there is anemia. Okay, or there is a chronic inflammation because of which the RBCs are not being able to produce. So then there can be anemia. So these are the various causes of anemia. So whenever we get a patient who is presenting to us with anemia, there is no point in just putting that patient on some iron, B complex, folate, etc. We have to find out what is the cause of this anemia, whether it is nutritional deficiency, whether it is blood loss, whether it is immune mediated, whether there is some issues with the marrow, or all these have to be ruled out, and then we will have to treat the cause. To treat the anemia, we will have to treat the cause of this anemia. So I have told you, either it could be excessive bleeding like menorrhagia, hematuria, GI bleed. It could be a leaky gut. There is celiac disease, Crohn's disease, where the absorption is not happening properly. The gastrectomy, the stomach has been removed, bariatric surgery, there is no proper absorption, patient ends up in having anemia. There is a low stomach acid, or there can be iron deficiency, B12 deficiency, folate deficiency, hence lands up having anemia. Patient is having rheumatoid arthritis, psoriasis, or any other chronic disease which will cause chronic inflammation, and again anemia. Intestinal disorders, I have told you, sprue or celiac disease or ulcerative colitis. Certain infections, parasitic infections, etc., they can cause anemia. Your malarial infection, they can cause hemolytic anemia. Like your kidney disease, like chronic kidney disease, etc., wherein the production of erythropoietin is hampered, and again there can be anemia. Your liver disease can also cause anemia. Autoimmunity, immune mediated hemolytic anemias. Certain medicines, they can cause hemolysis. that can lead to anemia. Enzyme deficiency like G6PD deficiency, pregnancy wherein there is an increased demand, growing children, lactation, all these can lead to anemia. Thyroid disorders, they can cause anemias. So all these can lead to anemia. Whenever we talk about anemia, we will have to analyze what could be the cause of this anemia, and we will have to treat the cause, because till we treat the cause we cannot improve the hemoglobin or the RBC content of that patient. So these were few of the causes of anemia. You can classify them in various ways. I have just given you a brief idea as to what all can cause anemia. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.